Hi, I'm Dr. Ostrick. I'm a board-certified hand surgeon and I work at Muskegon Surgical Associates. I've been with the practice for about 6 years, but I've been in practice for 15 years. And some of my specialties include thumb arthritis reconstruction, endoscopic carpal tunnel, office-based surgery, which includes things like trigger finger, and many other procedures, such as chronic nagging wrist pain, that is very difficult sometimes to figure out. So I do a lot of the ordinary plastic surgery and hand surgery that you might consider as part of hand surgery, such as trigger fingers and carpal tunnel, but I do some of the most complicated surgeries that are available, such as wrist pain and pain after fractures, and I also do a lot of fracture care as well. I wanted to tell you something I'm really excited about, which is our hand center and the total care that it provides. And you may ask yourself, what is a hand center? Well, it's basically all-in-one total care. So let's say you come to us and you have a hand problem. Not only will we diagnose it and treat it, we will rehab you. And we have some very exciting things to do that. First of all, we have this beautiful space where we can do surgeries and get x-rays and diagnose your problem. And the second thing that we have is myself and my partner, Dr. Terlau, who do hand surgery and can treat you for whatever problem you're having in your hand. And then we have two wonderful hand therapists that will rehabilitate you so you can get your hand back. We also have some other testing that's available that sometimes is hard to get. It's called an EMG. Let's say you have carpal tunnel or you have a nerve problem or something's not working in your hand and we need to get this test. Well, we have a doctor here that comes several times a month actually who does this test. Now, that test sometimes takes a long time to get, but we can get it for you and get you back on the road to recovery very quickly. So it's basically all-in-one care from the beginning to the very end. And it's one of the unique things. We're really the only hand center at this area on this side of the lake. And there's nobody quite like us. And we can provide you not only the best care quality, but efficient care. So we know that you have a life. We know that you want to go back to work and all the fun things that you want to do with your life. You know, summer's short here in Western Michigan, so you want to go back and enjoy it. And we can help you get back to what you need to do and what you want to do as quickly as possible. If you're having any issues with hand pain or any problems with your hands, give our office a call and we'd be happy to see you. And we're looking forward to treating your hand problem. I want to talk to you a little bit about endoscopic carpal tunnel. Now, endoscopic carpal tunnel is minimally invasive carpal tunnel. And what does that mean for you? Well, a lot of people have some misconceptions about carpal tunnel syndrome and they're afraid of it. They think the surgery doesn't work or it's very painful, or it will require a lot of time off and there are a lot of complications. All those things are untrue. Carpal tunnel is a very safe condition to treat under the care of a hand surgeon like myself or my partner, Dr. Terlau. And we do it in a very unique and innovative way called endoscopic carpal tunnel. Now, endoscopic carpal tunnel is minimally invasive, as I've said before. And what does that mean for you? That means that you have less downtime, the surgery's quicker, you can get back to what you want to do immediately. What do I tell patients when they have carpal tunnel and they're going to have the surgery and what they should expect? Well, a lot of times I do the surgery on Friday. And so what I tell them is that they can have their surgery on Friday and then go out to dinner that night accompanied by someone and enjoy themselves. They can take the bandage down, use their hand, wash their hand, drive the next day, and a lot of times, depending on what work they do, they can go back on Monday. I've had people who work very hard with their hands and they get back sometimes within days, a lot of times, most times actually within a couple weeks. Most people are told that it'll take 2 months to recover from carpal tunnel. Well, in this day and age, and in this particular economy, it's hard to stay off work that long. We understand that. We understand your needs at the MSA Hand Center, and we'd like to get you back to work as soon as possible. We want to make it as easy as possible for you to get carpal tunnel surgery and get back on your way. So give us a call.
Sounds good.
He's a natural.
I know.
Yeah.
Some people are click stuff and some stuff.
Let me do one more, a couple more.
You want to break this up, right? For the videos?
Yeah.
Yeah.
Yep.
Let me stop this real quick.
Yeah.
That was actually two of them.